Good morning. I work for CQC and we regulate, monitor and inspect all health and social care services across the country. And I manage the Cumbria end. We're there to make sure that health and social care services provide people with safe, effective, compassionate, high quality care, and over the next few years we'll have an extra added part to that where we are going to be encouraging care services to improve the quality of care that they provide. We're currently in a state of flux ourselves. We're going through, after various reports, the Francis report, Winterbourne, we're going through a lot of change ourselves in the way we work and the methodology that we use. And it's quite an interesting time to have Healthwatch come into that. Fundamentally, we won't change. We will still make judgments about the services that we inspect. We will still register new services that come into regulation, but we'll always be on the side of people who use services. And there's a lot of work going on in our organisation around the people's voice and how we get the people's voice across in our inspection reports, but also in those judgments that we make. And that really is why our relationship with local Healthwatch as well as national Healthwatch is important to us. Over the next 3 years, we're changing fundamentally the methodology that we use, and we're first of all starting to do that around the NHS. We want to make better information for the public, and that will be going back to ratings, which we did do some years ago in another guise, but we're now going to be looking at how we can rate services from inadequate to excellent. We're going to improve the assessments that we do. We've already employed chief inspectors of hospitals, chief inspector for adult social care starts I think in the next fortnight, and the chief inspector for primary care. And they will start to look at the organisation and the structure that we have, and that way our new improved assessments will aim to better enable us to highlight where care is good, outstanding, and also to expose where care is inadequate and where it requires improvements. And that's going to mean we have to have stronger national and local partnerships with people like Healthwatch. The 5 principal things that we're going to be looking at over the next 3 years for the start are, instead of having a range of standards that we're working to, we will have 5 around: are services safe? Are services effective? Are they caring? Are they well led? And are they responsive to what people tell them? So again, very much putting the people's voice at the heart of what we do. I've already met with David. Must have been some months ago. It's been so busy. It was some months ago, I think, that we first met to talk about how we could work together. We have a statutory duty to work with Healthwatch, and we also respond to issues that might come up through Healthwatch England. So we're going to be working nationally and locally. We've already had that first dialogue. We've talked about the visits that Healthwatch have done, and we've been talking about our programme. So Healthwatch would know, for instance, where we were going to visit during the year, although we wouldn't actually tell them the actual date, because we do like to keep an element of surprise. I think what's important to me is that less threatening talks that we've been having around, when we go in and inspect a service, we often find people are a bit reluctant to talk to us. One, because they think people can see them coming in to talk to us, whether it's a member of staff or whether it's a patient. So getting an overview from Healthwatch of the types of things that are coming up with patients and people using services is going to be great. We've produced a guide to help us work together with Healthwatch, and I'll be having regular meetings with David, and we'll be talking about the themes that are coming out and trying to evidence and help to change what's happening locally. I'm looking forward to working with Healthwatch and actually getting to know how we can work better as we go along, and I've been very cheered by what's been said here today. Thank you.